This is Dr. Alexander Haskell, and I would like to review a few things that I've said in the past about iodine and potassium iodide. Very, very important points. And a lot of medical doctors have probably told a lot of you who have Hashimoto's to avoid iodine. And I just want to make it clear the reason for that, and maybe or maybe not they would know the reason for their suggesting no iodine. Remember that iodine comes in various foods, and it will come in supplements, so you must be sure to read labels on products, on your multivitamins, and also be careful about taking thyroid combination products, because there's going to be some kelp or bladderwrack or whatever the name may be, and these are very rich in iodine and potassium iodide. So when did our interest begin in looking into iodine as far as a therapy? I think it primarily began in the 1975 research that came out of the Lancet when they did a global study on cancers from around the world, primarily breast. I think also ovaries was part of the research, and they found that the incidence of breast cancer was much less in Japan, in the Orient, compared with most other countries, and especially when compared with the United States. And through the research, the epidemiological research, they found the only possible difference that might cause such a reduced reduction of breast cancer in Japan was their dietary intake of iodine. And they speculated at that time that the possible mechanism could be that somehow iodine was helping to shift estrogens in the body away from estrone towards more estradiol and more estriol. And so much research began during that time from 1975. And we have a lot of research even up until 2008, when the University of Southern California Medical School is beginning to understand the association between thyroid hormones, low thyroid hormones, and greater incidence of breast cancer. Studies out of Pisa, Italy as well, showing hypothyroidism, goiters or enlarged thyroid, and also Hashimoto's has a much higher risk of developing breast cancer. But let's talk about iodine and potassium iodide and the reasons why you have to avoid it. As you know by now, we need to reduce TSH, because TSH stimulates the thyroid cells to produce more hydrogen peroxide, helping to convert iodide to iodine. And if we don't have adequate amounts of iodide, then the thyroid cannot produce enough thyroid hormones. They stay low in the bloodstream, and the TSH continues to be elevated to try to stimulate more thyroid hormone production. So we need to avoid iodine and iodide, because we do not wish to stimulate more production of TSH. Now, there are some testimonials showing how much iodine and potassium iodide helped a number of Hashimoto patients, but as far as I'm concerned, we have no idea how many became worse, how many people with Hashimoto's became worse. And it may be that those individuals